This is your incident command team for Delta County. In response to COVID-19, we have public health, we have Delta County Memorial Hospital, and Delta County. Today we have received news that we have an additional 3 cases, and the team wanted to reach out to Delta County, talk about the specifics of the case, talk about testing as a whole, and again provide that detailed information that we know that numerous of our citizens are interested in, and then wrap it up with, again, the actions being taken by our Emergency Operations Center as Unified Command.
I would like to speak to testing. Delta County Memorial has strict criteria with regard to testing. We have recognized from the get-go that we had limited viral media in which to do testing. Therefore, we did about a week of community testing and realized we needed to preserve our testing media for people at extreme risk, people where getting the test could dictate what kind of care they would receive. So we have pulled back substantially in the last few weeks on testing. And so we are testing healthcare workers with symptoms who've had a potential risk. We are testing people who are hospitalized and they're ill enough to be hospitalized, and getting those results will affect the kinds of treatments they receive. And then we're also looking at patients who are high risk. Perhaps they have an immunocompromised condition. We know we have patients in the community that have had lung transplants. Knowing those results early can make a difference in their treatment. So those are the tests are being reserved for that population. Therefore, up to 4 o'clock last night, we had tested 139 people at Delta County Memorial, and 1 test was pending. I was told by our ER that we tested 2 more last night. So every time we report our testing numbers, there will be approximately a day lag in those numbers. It is taking us sometimes 48 to 72 hours to get those results, but currently we have been fortunate that the last few results we've gotten in just slightly over a day. So we can't guarantee that will happen, but it is important that we are seeing those results quickly. We do recognize that some people are being tested in other counties. We have people that receive health care in Montrose or Grand Junction, and they may be referred to a testing facility in those areas. Everyone has the same criteria. They are only testing high-risk populations, people who are ill with COVID types of symptoms, or healthcare workers who have symptoms. We had a mobile unit that was deployed to Montrose County, and we were told at Delta County we could send participants to that. Our emergency room contacted 40 people who had been through either the emergency room or the urgent care and wanted testing, and we had not given them testing. The physician, Dr. Craig, wrote a note and offered testing to 40 people. 9 people from Delta County participated in that, and as of a couple days ago, they had not received those results, and that was about 8 days after that testing. So it's possible those results are coming in at this time. We also know that Mesa County received a very large number of viral media to be able to test healthcare workers. And so that is set aside to keep the population that keeps you safe. So that's for frontline, emergency preparedness people, police, EMTs, nurses, physicians, anyone that is considered crucial in this fight against COVID-19.
So it's Karen O'Brien from the Delta County Health Department. We released a press release today to talk about that the department is investigating the 2nd, 3rd, and 4th case of COVID in Delta County. The 2nd case is a male in his 50s who is self-isolating at home. The 3rd case is a female in her 60s who is a close contact with the 2nd case and is also self-isolating at home. The 4th case is a female in her 50s who is also self-isolating at home. As we receive the information from the state health department. We will present more information out as soon as we can. Thank you.